Dr. Kara Robinson. And then Dr. Kara Robinson is our sponsor professor and has been awesome at helping us get set up in all of these situations. Dr. Robinson, is there anything you'd like to share?
I just want to thank everybody for joining us today and learning from Rachel from GNRC. And I want to thank Sean and Marion for doing a really great job organizing this event. So thank you.
Thank you, Dr. Robinson. So at TSU CARES, our mission is to understand and promote through rigorous research, education, and practice the quality of life and aging process over the lifespan of individuals in our local community and state. That also aligns with the focus of TSU CARES and our strategic goals, which are to increase knowledge on aging in Tennessee, to increase human capital in of Tennesseans prepared to engage aging issues, and lastly, to serve as a training and service laboratory for undergrad and grad students and community partners. So, with all of that in mind, we couldn't think of a better first speaker than Rachel Solava of the Greater Nashville Regional Council to kick us off and to share with us what she and her organization do on a daily basis and how they're impacting the Middle Tennessee area as it pertains to the aging population. Rachel, take it away.
Thank you, Sean. I'm gonna start to share my screen. Thumbs up, is that perfect? Okay. Well, thanks so much for having me. My name is Rachel Solava, and I serve as the Outreach and Advocacy Manager with the Greater Nashville Regional Council, which is kind of a mouthful, so we'll say GNRC from here on out. And I'm going to focus on our aging and disability services today. I do briefly want to share with you that we are one of 9 development districts in the state. We are covering 13 counties in northern Middle Tennessee. So if you can see that map with Davidson kind of in the center and then those surrounding counties. We represent, we have 93 council members who are our city and county mayors. We have social equity reps and business reps on our regional council, and we have over 80 professional staff members, almost half of which are dedicated to our aging and disability services. So I definitely want to kind of zoom out and share, starting at the federal level, we have the Administration for Community Living, ACL, and that is a division of the U.S. Department of Health and Human Services. And then at the state level, we have a kind of recently formed Department of Disability and Aging, DDA. And both of those entities have designated GNRC as the Area Agency on Aging and Disability, the AAAD. So we use a lot of acronyms in this space. If you have any questions, feel free to put those in the chat or jump off mute. But I'm sure that as you go through your training, you'll learn more about all those different divisions. But one of our responsibilities is to plan and coordinate the local provision of services funded through the Older Americans Act, the OAA. And so there are 9 AAADs, Area Agency on Aging and Disability, in the state. And I wanted to show you that map in case you have friends, family, loved ones in Memphis, Johnson City, anywhere in between. So GNRC's region is that light yellow beige color. And there's actually an area agency on aging serving every city, every county, in every state. This is a federal designation. So you can use a website called Elder Care Locator. And if you type in a city or if you use a zip code, that will show you a very similar resource. Because we all receive federal funding, we have very similar programs, but the way the ACL, the federal government, envisioned using these programs is giving a lot of agency to us here at the regional and the local levels to make those decisions with these fundings, to say, what does northern middle Tennessee need that's different from the Memphis area, from the First Tennessee Area Agency on Aging. So we're kind of gonna get into some of those specifics as I describe more about our programming with you. So broadly, this is what our role is like. We want to be able to maximize our funding sources and ensure that there's essential services available specifically for minority, rural, low-income older adults. And we want to help people remain in their homes as they age. You might have heard the phrase aging in place. We want to help decrease social isolation, and we want to improve wellness. So we establish goals, priorities, and objectives in our area plan. That's our guiding document that we use to share with the public to say, here's how we plan on using these state and federal funds over the next 4 years. We serve as the gateway to information and assistance. I'll talk about our helpline as we get started. And then we screen individuals for their eligibility for certain programs, and then we want to connect them with services through our provider network. All right, this slide shows the Older Americans Act, which I mentioned earlier. That was passed in the 60s, and it still exists today. It's really our most vital form of federal funding that's geared specifically toward older adults. And I just wanted to show you that these are the big buckets of funding on that left-hand side where we receive our funding. And then on the right-hand side, we've kind of broken it down to show you how we describe those programs. And I'm going to go into some of these details throughout this presentation. But it's also important to note that there are other needs and services that exist outside of these big buckets. And that is one challenge of that we have restricted funding. We can't necessarily pay for all of the needs that we know exist for our older adults. So something to keep in mind as you think about your own work and your own future, whether it's serving older adults directly or peripherally. All right, next I wanted to share, I think it's really important, especially in this line of work, to pause and say, wow, we are doing really good work, even if it feels hard in the day in and the day out. So in 2025, we were able to help over 8,000 people who called our helpline. 8,900 individuals received assistance with their Medicare questions. Over 600 individuals received in-home services. And then I love this number at the bottom, the 5,000 individuals received meals through our nutrition partners. And we know how difficult food insecurity can be in our region, in our state. And so that makes me feel good that there's one small way that we're helping older adults get fed. We definitely can't do that work alone. So as part of my role doing outreach, I get to build partnerships. I get to maintain and strengthen our existing partnerships. So it's really important to be able to share those with you. We have a lot of external partners who provide those direct services. So you won't see a GNRC van driving around delivering those meals. For example, we work with Metro Social Services in Davidson County for home delivered meals. And then in our other 12 counties, it's all the same partner. It's Mid-Cumberland Human Resource Agency, MCHRA. We have a really robust aging network. You are currently part of it with TSU CARES. You are learning the ins and outs of what it takes to be advocates, to be specialized with this specific demographic. So you might already be familiar with AgeWell, for example. They're a local nonprofit. They put out a directory of services every 2 years. And that's what we keep on our desks when we're answering the helpline. 50 Forward is a network of senior centers in our region that provides services and just gathering places for our older adults. And then other trusted partner organizations. It's really important that we build trust with older adults, with vulnerable communities. So I will go to churches and civic groups and anywhere that I'm invited, essentially, to be able to spread the word. Because if people don't know that we exist, or there can be hesitation when it comes to quasi-governmental agencies, who to trust, how do I know that you're not gonna exploit my information, etc. So really building that trust and building relationships, if hopefully with the older adults themselves, but also with those other entities and those partner organizations. Okay, now we're going to get into the thick of it. So it all starts with our information and assistance helpline. The local number here is 615-255-1010. You'll see that on all of our brochures. And I can definitely share some of those electronically, maybe, if we want to send those out, or share them somehow with this group. But the helpline's the best way to reach GNRC. You are welcome to visit our website, but we know that our older adults still want to have a phone conversation with a real life human being. And that is staffed here locally in our Nashville office, 8 to 4:30. If you call outside of those hours, or if your client is calling, please encourage them to leave a voicemail. We do experience some high call volume, and so if we can't answer every phone call live, we are very diligent about making sure that those calls receive calls back. So it's free, it's open to any individual, regardless of age, status. You can call as a professional if you have questions, if you're trying to build your own knowledge base, or if you have friends or family in the area. If you're already working with clients, you can encourage them to call, or conference call on behalf of those clients as well. We receive a variety of questions on the helpline. So sometimes it's straightforward, like, well, how do I sign up for Meals on Wheels? Or I need help with transportation. And then other times it's a much more in-depth conversation. For example, if we speak to a lot of caregivers, right? So they might not even know what questions to ask yet, and they're just feeling overwhelmed and they need help navigating the system. We love having those conversations on the helpline as well. The second bullet point says person-centered approach. And in this group, I think you kind of know what that means. And so our counselors do a great job on the phone understanding the needs of that individual. Maybe they called about Meals on Wheels, but that could also mean, are they homebound? Do they have transportation options? Does that mean that are they receiving their medications on a timely basis? Is someone helping them get those medications? Do they need to set up a delivery service, etc.? So it can really snowball with that just one simple question and trying to get a more holistic picture of their needs. And then on the helpline, we can answer those questions, provide additional referrals to external partners, and then we will also start the screening process if there's interest in some of our programs, and we can help answer questions about the specific eligibility for different programs. Oh, I should also note, we use a translation line for a variety of language services. You know that our region is growing and diversifying, and so it's really important for us that we are also meeting the needs of our Spanish-speaking community members, Kurdish, Arabic, etc., etc. All right, I mentioned transportation. Unfortunately, I'm not here with a silver bullet to solve traffic problems, or answer the age-old question of how do I have that really difficult conversation if an older adult shouldn't safely, isn't shouldn't be driving anymore if it's no longer safe. But we do get a lot of questions about transportation. So I'm here to share a few of those resources with you. You should know that WeGo has a reduced fare for older adults. They are rolling out a journey pass as well. Maybe you've heard about it. So this will offer free transit rides to certain members. They are starting with community members who are already enrolled in social service programs with select metro departments. We also have a program called Access Ride, and this is our paratransit option for people with disabilities and also people who are unable to safely get to a bus stop. You might be familiar that not all of our bus stops have sidewalks or shelters, etc. So keep that in mind if you're working with any clients who might be able to benefit from that program. There is an application for the access ride, so keep that in mind. And then we have a volunteer driver model nonprofit here in Nashville. It's called Senior Ride. And so this is a program where volunteers sign up and they offer rides to our older adults. And so that really helps with the social connection, maintaining independence. So for older adults to get to the salon for their haircut or to church, to the grocery store, to the senior center for activities, etc. And then outside of Davidson County, we work with Mid-Cumberland Human Resource Agency again. Not only are they providing those home delivered meals, they are doing the transportation also. And then we have two other volunteer driver models, Wilson Ride in Wilson County and Community Life Ride in Sumner County. Okay, next I'm going to share about our Medicare counseling program. This is a federal program called SHIP with a P, which stands for State Health Insurance Assistance Program. This is free, unbiased, non-commissioned Medicare education and plan comparison. That means we as an agency and as individuals, we cannot sell Medicare Advantage plans. We don't receive kickbacks from insurance companies. We want to educate our community members about the ABCs of Medicare. If you've heard anything about Medicare, you know it's a little more complicated than it needs to be. And so we need to help educate people of all ages, but especially people approaching the age of 65 about what they need to do in order to sign up. Because yes, there could be penalties if they miss their enrollment date. And it's just, it can feel overwhelming. And so we are a free resource here locally that we just want to provide that education to community members. So the plan comparison means that during open enrollment, so this is the period of time between October and December that every Medicare beneficiary can and should be reviewing their plans because plans change. Your provider might not be in network anymore. We need to double check if your pharmacy is still in network, which prescription drugs are covered or not covered, and how much are you spending? Because if you're already on a fixed income and you're struggling to pay for those prescriptions, we want to have those conversations. There are Medicare savings programs out there to help with especially prescription drugs. We have examples of saving $4,000 up to $6,000 for individuals on their prescription drugs just by reviewing those plans year over year and saying, hey, let's make sure that you still have the best plan that works for you. And on the screen, you'll see that helpline number. It is an 877 number. It's a statewide helpline. But then based on your location, it will get directed here to GNRC. Or you can always encourage your clients to call the local number 615-255-1010. And we'd be happy to connect you with our Medicare team. Okay. Next, we'll talk about in-home care. So I mentioned the phrase aging in place, and that's one major goal of us as an area agency on aging and disability. So I hope you're starting to make some connections, whether you envision yourself working directly with older adults in your future, but even if you work with families of all ages, they might have an aging parent, or you might come across this, especially if you work in a hospital setting, if you are a discharge planner, etc. So a lot of our older adults or adults with disabilities need help in the home. Services like meal preparation, housework, medication management. These are all considered home and community-based services. So GNRC helps promote, screen, and coordinate these services. There's kind of two different programs. One is state funded, and it's called Options for Community Living, and the other is federally funded. It is through Medicaid, TennCare in Tennessee, and it's called the Choices Program. So that's long-term services and supports for low-income individuals. And these programs have different eligibility. I won't get into the specifics right now, but if there's questions, I'd be happy to answer those at the end. So this is just an example of some of the services that they could receive. And so GNRC will help provide the screening, the eligibility. We do provide some case management for those options clients. And then we use contracted providers to actually go into the homes and provide those services. And the helpline is the best way for someone to start getting more information about in-home care. We know that there's a very large gap of individuals. So most in-home care is private pay. And if you cannot private pay, then it can feel really overwhelming and difficult to know where to go next. And you're welcome to refer those clients to GNRC. All right, and then we'll move on to our family caregiver support program. This is one of my favorite programs to talk about, if I'm allowed to have favorites. We want to provide support, education, and respite to family caregivers, informal caregivers. This is really dear to my heart because my parents are caregivers. I anticipate being a caregiver for them later in life. So you probably know a caregiver. Maybe you currently are, or you also plan to be one sometime in your life. So we can help get family caregivers connected to support groups. We partner with an agency to offer in-home dementia training for that individual, for that family member to learn about the changes that's happening to their loved one. And then we can also offer reimbursement for respite. You might have heard the term respite before. This is short breaks for the family caregiver to take care of themselves. When we're on the airplane, we hear that we need to put our own air mask on first, right? Or you can't pour from an empty cup. So that's the ethos of this program. We want to make sure that caregivers are not reaching burnout, because then they either are struggling to be a good caregiver, and or then that might mean a family member needs to transition out of the home as well. So in our program specifically, we can help 4 different kinds of caregivers. The first is if you're caring for an individual who's over the age of 60. The second is if the caregiver is 55 or older and providing care to an adult with a disability. The third is if the caregiver is providing care to an individual of any age with an Alzheimer's or related dementia diagnosis. We know that those diagnoses can come at almost any age, and so we're not going to put an age restriction there. And then this final category is kind of special. This is for grandparents or relatives who are 55 and older, who are the primary caregiver of a child. This could be by blood, marriage, or adoption. It means that the biological parents are not in the household, they're not in the picture for a variety of reasons. And we see this increasing specifically in our region and a lot in our rural counties, whether that's due to overdose or incarceration, a variety of different family circumstances. And here, the respite actually looks like enrichment services for the child. So it could be after school care, tutoring costs, summer camps, day camps. When an older adult becomes the primary caregiver of a child again, they might not be financially able to provide all of that care, and they just might be feeling overwhelmed for other reasons. They already went through one parenting cycle, and it might look really different in 2026 now, and so we want to offer support to that group. Okay, we'll kind of transition now into our elder abuse prevention. If you think back to that slide about our older Americans funding, elder abuse prevention is one big bucket of our funding. So I kind of wanted to share with you a variety of how we use it and who we work with in a variety of ways. So you may already be familiar with Adult Protective Services, APS. We send all of our referrals to APS. We here at GNRC don't investigate any claims or instances ourselves. We do all of that through APS. Next, I wanted to share the Ombudsman program with you. I had to learn this word when I first started at GNRC, and an ombudsman is an advocate specifically for our individuals who live in nursing homes, assisted living facilities, etc. And it's for either the family or the individual themselves to turn to if there's any challenges or concerns, especially if you've tried to work with management at the facility and it's not going well, for example. So an ombudsman could kind of step in and help in that situation. Internally, we use a lot of our elder abuse prevention to raise awareness about financial abuse and scam prevention. We do have a program called Senior Medicare Patrol, SMP, and this is specifically focused on Medicare fraud and abuse, helping older adults learn what that looks like, how to identify it, how to detect it on their EOBs or their statements, make sure what services that you received are being billed appropriately to Medicare. And then finally, I just wanted to share the Elder Financial Abuse Hotline for financial institutions. This was a recent collaboration across the state, and they've passed legislation to establish a new 800 hotline for financial institutions to help protect vulnerable adults from financial exploitation. We have a lot of concerns about elder abuse and fraud. And so this helpline is going to help financial institutions like banks report suspicious activity and prompt that investigation by local or state law enforcement so that they can help guard our older adults. Okay, we also have a bucket of funding for our senior centers. And we love working with our senior centers. I really consider them the boots on the ground. When we think about trying to cover a 13-county region, there's different needs here in Davidson compared to Trousdale, Stewart, Dixon, etc. And so our senior centers are really a lifeline and a physical building for our older adults to go to for socialization, activities, obviously exercise and fitness, but art and music and trivia and other engagement that they really enjoy. So we're so grateful for these centers to be open and active. We help partially fund 14 currently. And in one of the ways we do that is through our evidence-based programming. This is specifically around health promotion. I mentioned fitness and exercise, also offering health screenings. Sometimes we talk about nutrition, etc. And also at our senior centers, we have a relatively new program. So this is outside of traditional OAA funding. We've found external sources for this funding. Right now, we have a grant with Tennessee Department of Economic and Community Development. And we're in year 2 of this grant project, and our goal is to serve over 500 older adults in the region. And we do this at senior centers, at churches. We have some classes, hopefully at the Magruder Centers soon in North Nashville. And this is a 15-hour class for older adults to learn computer basics. So you see in the photo that they are practicing on a Chromebook. They learn how to make a Gmail account, get into their email, stay safe online. We talk a lot about internet safety. That also relates to our scam prevention. And then after they complete these 15 hours of training, they receive that Chromebook for free. So they get to take it home. They've learned some of the basics, and now they have a device that they feel hopefully more comfortable and confident using. All right, and then as we wrap up some of the big buckets of what GNRC does with our aging and disability services, I wanted to also highlight our volunteer program, partly because this is how I got introduced to GNRC. I started with our letter writing campaign. Every month we invite volunteers to write cards and letters. We collect those and we disperse them to senior housing, nursing homes, facilities, and we want to connect with our older adults and make sure that they know they're not alone, they're not forgotten. So that's one volunteer opportunity. Our Medicare program relies heavily on volunteers, so if that's ever of interest to you, we do outreach if you want to spend more time with me. We have friendly visitors who start building a regular relationship with clients and we'll go visit them on a regular basis. We have admin work if you want to come into our office. So gnrc.org/volunteer if you want to learn more. And we also have a rolling internship application, just so you're aware, if you want to look at that on our website as well. Okay, I'm going to take a sip of water, and then we're going to kind of zoom out a bit, and I won't overwhelm you with data, but I wanted to share at least 2 data points that I think are really interesting to this work. So why I think this matters, especially in your field and the work that you are currently doing at TSU CARES and hopefully in your future careers. Maybe you've already heard this in some of your training, but professionals in the field are acutely aware of our growing population of older adults. So in Middle Tennessee, overall, we've cleared the 2 million mark, and our older adults, so this is age 55 and older, they make up a quarter of the population. And then I have the age breakdowns a little bit further for you. So 55 to 64 is over 248,000 people. And then you'll see the breakdown 65 to 74, 75 to 84, and then over 85. I think that's really important to our work because those needs change. You know, someone who's 55 might be looking very independent still, or maybe it is someone who already has multiple comorbidities and is already receiving services. So we can't necessarily paint them with a broad brush, but it is important to know some of these data points to know the number of people we might need to be serving at some point in their lives. And then here is our population trend through 2045. So the 55 plus population is projected to be just shy of 1 million people by 2045. And that is a 51% increase from 2020. So we are definitely thinking about how we as an industry and as a region are preparing to serve those needs. And so here I just wanted to share some of the key challenges and issues that we are seeing from a regional standpoint, but also from the individual clients that we're serving. We know that there's both personal and community challenges that are impacting this population. The cost of daily living has a financial impact on older adults, their family, and our community. We know that there is a very competitive housing market, and that leaves little room for middle and low income older adults. And the limited resources impact their quality of life and their personal health. And because we talked about caregivers, we know that the number of people in that caregiving circle, that number is just going to grow, and it takes a toll on those individuals, both personally and professionally. And so that could impact the workplace and we see economic challenges as well. We don't want to leave a segment of our population behind, and we want to still have a good quality of life for all Middle Tennesseans. So we know that the demand for services will continue to increase, and these challenges have wide impacts, and we want to be able to address them in a coordinated and proactive way. And so that leads me to kind of connect some of the dots and talk about this age-friendly ecosystem, which is really growing in awareness and popularity. There's different sectors who are aware of our aging population, and I think they're doing a great job of thoughtfully addressing some of these needs in plans and policy and intervention. So public health is a great example, transportation, the built environment. There's a lot of different ways to think about how to be age-friendly. Our health department has received a age-friendly designation. And then AARP is also really involved in this work. They use 8 domains of livability to improve the quality of life. It's geared toward older adults, but ultimately it really improves quality of life for all of us involved. So Nashville is in that process. Wilson County is going through that designation. And we already have several cities who have achieved their age-friendly designation through AARP, and that includes Franklin, Gallatin, and Clarksville. And then I also just wanted to let you know that Tennessee is in the process of adopting a multi-sector plan for aging. And this is a cross-sector, state-led planning resource that can help the state transform infrastructure and coordination of services for our growing aging population and people with disabilities. The plan aims to establish a framework to incorporate aging and disability lenses across the state priorities, and that goes beyond just traditional healthcare and community services. And GNRC is striving to be a part of all of that work when we can, and be able to lift the voices of our clients and the populations that we're serving when we think about those policy and systems change. So just briefly, Sean, I'm looking at the clock. I have a few slides about reframing aging. During our prep meeting, the question came up about what I would want to share with, people still in training, kind of coming up through the ranks, so to say. And something that I've learned, I've been with GNRC almost 5 years, and we are talking more and more about ageism and how to reframe aging. And so one of the questions I would pose to you is what messages you receive from our culture about aging. It's really important in the work that I do and that GNRC does, because our staff is working with older adults on a daily basis, but also how I communicate to our partners, to our stakeholders, to our regional council board. We want to help them understand the pervasiveness of ageism. And so, just as social service professionals, we want to be more inclusive. And so, identifying ageism is a really good place to do some of that work. There's studies that show children as young as 4 will start to become aware of their culture's aging stereotypes. We will start to internalize those, and then those stereotypes guide how we perceive and understand ourselves, but then also other people. And we know that ageism intersects and exacerbates other forms of isms, sexism, racism, ableism, etc. I could have shown you a variety of anti-aging commercials. In America, we're scared to age. We don't want to show our age. We don't want to talk about it. We want to fight against it. Or in the media, there's also 2 extremes. If someone is really frail, we still use the word senile sometimes. We know that care could be really expensive. Or on the other extreme, we see older people who are active and healthy and wholly independent, and they don't need any support. We know that aging is a spectrum, and so we need more inclusive portrayals of what aging is, because if we just see the negative, then we don't want that to happen to us. But ironically, if we only see the positive signs, that I'll say it, successful aging is only linked to individual lifestyle choices, how well you eat, if you're exercising, your financial stability. But we know in this space that social supports are a huge part of those factors. There's structural and systemic factors that are impacting those choices that seem like individual choices, but ultimately either constrain or impact us as individuals, but ultimately as a society. So just briefly, I would encourage you to visit the Frameworks Institute. Reframing Aging has a great website. So I'll just start with, I could have shown you more pictures. Birthday cards are especially insidious with ageism. But just, I think one small way is to think about our language for sure. This isn't happening as much, but I would say even 2 to 3 years ago, we were catastrophizing older adults. The media was using phrases like silver tsunami, what happens when the boomers retire. I'm not gonna change how media talks about it at large, but I can impact how I share about those population changes. And you might have noticed that we are trying to use older adults almost exclusively in our language. Senior centers still exist, and so we don't want to erase any of that. And then there are very specific demographics who maybe elder is a form of respect, and they want that acknowledgement. And so it is an individual choice. I think you as an organization and then you as an individual can choose, especially if you're working with an individual, if you can ask, how they think of themselves or what words they want to use. And just in general, we want to avoid othering, right? So we don't want to portray older adults as separate groups. We want to use we and us as we talk about what changes we envision, what we hope for, that can also benefit older adults. So I will end there briefly and give you our website, gnrc.org/aging, and then my email address as well.
Awesome. And Rachel, thank you so much. I cannot tell you how much I appreciate the time you took out to prepare this. This was a fantastic presentation. I personally feel like I know far more about GNRC and the resources that are available, and then even how to reach out and help other people and older people find those resources. At this point in time, we're going to open it up for some questions from the overall group. So if you have any questions for Rachel, you have an expert on hand about the older or aging population and the resources available.
Hey Rachel, I seen you mention something called Meal on Wheels or Wheels on Meals.
Mhm.
What's that?
Those are home delivered meals. So for older adults, mainly people who are 60 and older, and can no longer get out of their home or apartment, if they aren't able to go grocery shopping or cook for themselves, there's a service available for them to receive fresh, healthy meals delivered to their homes.
Thank you. And also, I had another question about the biggest problem with the aging slash elderly population in Middle
Mhm.
Tennessee. What's the biggest problem that y'all go through?
It's hard to name just one because they're all kind of interconnected, right? So, um, I think I'll share, we get a lot of calls about housing, and it's particularly difficult because if you remember that slide about our funding, we don't receive any housing funding. So that's something that we're trying to actively work with our partners and our council to get more creative, to be more innovative in that space, but trying to figure out where to send our community members when we do get those questions. You know, we work with MDHA. You might know that they have wait lists for their housing. And so that is a present challenge and will continue to be a big challenge for us as a region.
Rachel,
Is
I
your
know.
organization? Oh, I was going to
No,
ask a
go ahead.
question about budgeting and your finances. Due to the cuts that are taking place at the federal level, are you guys experiencing any cuts or see anything coming in the future as a result of the cuts at the federal level?
Yeah, thank you for asking. Presently, we are feeling fairly stable. We've seen small cuts, nothing compared to the SNAP funding that we saw earlier in the year, or was that last? You know what I mean. Um, but we are concerned about our partners and our community members because SNAP is a good example. If people are already struggling to pay for food and for groceries, then we have concerns about how they're paying for other basic needs. So that's something we're always keeping our eye on, and we feel really strongly about educating our community members, groups like this. Um, that's I hope it didn't feel too dry for you, but that's why we talk more and more about the Older Americans Act, because we want that legislation to exist. We would never want that funding to go away. And so it's really important for us to educate everyone to say that meal you just received trickled down from the federal government, and here's how. And even if you don't remember GNRC's name or the Area Agency on Aging designation, hopefully it sticks somewhere in there of, oh yeah, like there's multiple players who have to touch all of these invisible dollars to help make sure that that meal gets delivered to my neighbor.
Andy, Deb, go ahead.
I just had a quick question. Hi, first of all, thank you, Rachel, for doing this. My question is, do you introduce older adults into your fray? Do you hire people that are older?
Oh, that's a great question. We do not have any discrimination in our hiring process. I should feel that I being recorded, but depending on
course.
their qualifications, we would encourage that, of course. We do see people of all ages volunteering with us, but especially older adults who are retired, semi-retired, who enjoy giving back. It's a wonderful outlet to be able to connect with them in that way. There were other programs that have experienced cuts. I'm trying to recall, I think AmeriCorps used to have a very specific older adult program to help people, older adults, either start new careers or help with their job search. That might have been cut. I apologize for not knowing the specifics, but that's a great question. We know that it exists, and from the financial standpoint, we know that older adults might want forms of income that, are, if they're feeling that squeeze financially, then being able to support them either returning to the workforce or, finding initiatives that could work for them.
I'm sorry, maybe I wasn't clear. I was trying to be more specific. Like, do you hire people that are older? That's what I was trying to get at. Okay.
Yeah, we would welcome their applications.
Gotcha. I gotcha. Just wanted just to check to see if you had that reflection in your staff. Thanks.
Rachel, we do have a lot of students on this call, many of them who will be graduating in the next 3 months. In terms of maybe looking to get into GNRC as a potential employer in the future, what advice would you give to us or them?
I don't have specific advice. I think I shared with Sean during our prep meeting that my career is a lattice, not a ladder. I hope that you can meet other GNRC employees who have a variety of backgrounds. I think that's maybe something that I've learned and would love to share with this group because, I didn't know what an area agency on aging was before I started here. I think that's the joy of trying different career paths. So my degree is in English education. I thought I was going to be a high school English teacher, and I'm so happy that my life has led me down different paths. And so I hope that regardless of where you end up, I know that you'll be having a positive impact because you obviously have a heart for service. You've chosen this degree for a reason. And I'm obviously biased, but I think that whatever setting you end up in, you're going to have the knowledge and compassion to help a lot of people.
Rachel, again, on behalf of TSU CARES, I do just want to say thank you again. We really appreciate you taking time today to share this with us. Again, hopefully we're all better informed as a result, and we can look forward to hopefully partnering and volunteering in the future, as well as maybe finding some career paths within GNRC for some of our students. I did just want to have a quick plug or a quick announcement. So we will be having our second TSU CARES speaker for our series, Rolanda Caton, the COO, Chief Operating Officer of 50 Ford, another older population organization, on Wednesday, March 18th. Again, that'll be at noon. So thank you all for joining us over the lunch hour. And then Rachel will actually be appearing on ABC News Channel 2 on March 4th at 11:45 for a Newsmaker segment. And she'll be discussing, again, some of these things that GNRC does, as well as giving a shout out to TSU CARES. Thank you, Rachel. Again, we've just been so elated to have you today. And I just want to say thank you again for everybody for your participation. We will have a record of this call in this organization. And then Marion is actually going to be hosting a podcast with myself and Rachel, which we'll be recording in the next couple of weeks. So you'll be on the lookout for that as well. Thank you all again for being here for TSU Cares. We appreciate it, and we look forward to seeing you at our next speaker series. Thanks again, Rachel.
Thank you.